Okay, so again here, I'm asking him to take his belly button and hold that position. So this is almost like kind of a modified plank position. Hold and put your arm in front of you and down and relax. And hold and try and do arm and leg at the same time and down. And again. So if I wanted to do some isometric or stabilization, I'll say hold that position, and then I'll give him some perturbations as he holds this position. Okay, and down.
He's focused.
To progress from here, you can do a plank, right?
He can
Let
try.
me have you come down. You can try. All right. If someone's going to struggle to do a plank, they're going to. You can bend your hips. They're going to go up like this here to make it easier. If they come down and they hold this position and they're flat, and you want to go according to seconds, so maybe he'll do 20 seconds for 5 reps, and then. Huh? You can make it progressively harder by doing one arm. Okay, you could do one leg.
Change the channel and the volume.
All right, and then the side planks will go on your side. Someone else to do it?
No.
Okay, all right. And then put your, there you go. And come up. Hold that position. And down. One, and again. Hold. And then you can, if you can, and down. So this is some higher level type exercise. It's
Woo! You didn't know how many you wanted.
I don't know.
that's fine. Any questions on how to make it easier for someone and to make it harder? Any comments?
Oh, yeah. At my clinical.
Yeah. Bring your clinical experience in. So.
I can show.
Yeah. Oh yeah. Please. Yeah.
Yeah, the table.
Oh, you got it?
Sure.
There was one that they're on quadruped. They had like the foam pad underneath them.
We have a phone pad, right?
Yeah, we do.
Phone pad.
Yeah.
It's for the first.
Okay, guys, watch up.
So he was just going like that. With what's it called? The multipids.
Okay. So
And
just do a
then-
little so unilaterally they're working on it.
Yeah.
The rotation. Okay.
And then they did the fire hydrant.
Go ahead. All right. So your easier way to do that would be go ahead and lay on your side on this side, and you just basically do a clamshell. So put your lay down here and relax. So essentially, you instruct your patient in how to lift up, but you want to be careful that they don't rotate their whole spine and they cheat. So you want to stabilize, okay? And you want to make sure that their heels are touching and they just open up and they contract the external rotator, hold, and down. So then you could do multi-angle isometric. So, she has this whole range here, and I may start her out and say hold. So in the beginning part of the range, I may let her come to the end part, hold. So depending on how you want to stress your patients, at the beginning or at the end or so forth, or you can just apply manual resistance through there. And then as she gets stronger, she can go in other positions, or as she gets weaker, you can vary it. Okay, very good. That's pretty much all I wanted to show you guys with spondylolisthesis and spinal stenosis. Doctors will order what's called, Williams. Have you heard of those? Williams flexion exercise? There's some doctors who will write a prescription to do Williams flexion exercise. It's basically a series of lumbar flexion. And simply, it's just basically pulling your knees up to flexion. But again, if somebody has problems with a disc and you flex their spine more, okay, potentially it could push the nucleus propulsus out further against the annular rings, and they could have more symptoms go down their leg. However, remember I told you guys, if you take a MRI of 50 people, 25 who have bulging discs won't actually have symptoms. So even though the etiology is a bulging disc, you have to go by what their symptoms are. Now, Eli's a good example. He has what's called, he has a lumbar extension dysfunction. So he's not able to extend his lumbar spine. And we'll see that in a minute. Well, pull your knees up to your chest and hug here. So when you look at him, I mean, he really doesn't have too much problem flexing his spine, maybe a little tightness in the hips, but certainly I wouldn't consider that abnormal or a deficit. So now when he rolls over to his stomach, okay. All right, so now watch his belt line in relation to the table as he extends up. So go ahead and press up. So this is really, I thought he was faking, but really he can't extend his spine any further. Now
He said he was normal
and down.
earlier.
And so what's the relevance? You ask the patient, do you have back pain? If he says, oh yeah, I have back pain, then I'll say, Eli, where's your back pain? So he'll tell me. So is this true to you? Mm-hmm. So he truly does have back pain. And point again, where is it? So he's pointing to the right side, okay, and he's pointing up higher. So at this point, I'm thinking muscular, unilateral, and so I'm going to do a couple things to see if I can make his pain worse. So one of those, it's called provocation of symptoms. So if someone has shoulder impingement or someone has a positive slap, you want to put them in positions to see if it's doing it every time. So what I'm going to do to Eli is I'm going to say, go ahead, and I want you to give me a number on a pain scale of 1 to 10. What's your back pain?
2.
Okay, so go ahead and now press up 10 times. And good. And press up and let your stomach sag. Hold. And down. And press up again. Hold, let it sag. So I'm going to say now, was your pain better or worse or no difference at all?
No, it went up to about like a 3.
It went up to a 3, so it got worse. So extension made him worse. So now I want to see if a stretch technique is going to actually make him feel better with more flexibility. So I like to use my hands when I work, so I'm going to go ahead and do my particular technique here. So take a deep breath in and press out and exhale. And as he exhales, I give him some pressure, and I'm holding him here and down. And we're going to do 2 more. And breathe in, press up, exhale. And down. And again, breathe in, press up. After 3 of those, now is your discomfort better, worse, or same?
No, it went up a little bit.
Up a little bit. So then I wouldn't want to make it worse. So I would turn him back over. I would work on spinal flexibility, flexion, because I wouldn't want to, even though he has a deficit, now's not the time to try and regain it because it's making his pain worse. Okay, so if the pain goes up, you want to stop. He doesn't have any, you don't have anything going down your leg, so he doesn't have any peripheralization, but if he did, that'd be another reason why I want to stop. Okay, so his symptoms are going to drive my treatment. Okay. Good. Thanks. All right, so I want everybody to get